Hello family and welcome to Kamy Ideas. If you are new to the channel, don't forget to subscribe and turn on the post notification bell so you receive notifications whenever I upload a new video. In today's video, I want to discuss, or I want to share with you something very important, and that people do not know whenever they go to the hospital. And some people feel like I'm a patient. When I go to the hospital, anything they give me, let me just take it and go. After I'm the one looking for help to my condition. It's not like that. There are people who know their rights and others too are just ignorant. So because of that, they come to the facility and you find yourself in an unfortunate situation, and then you are intimidated by maybe you don't want us to do this and that, and some are scared to even though some people even know their rights. Sometimes they feel afraid to express how they feel, because they feel that what if I say this and they end up giving me a wrong medication? It shouldn't be like that. The person should give a wrong medication. There's always a bigger God up there watching over everything that everyone does on this earth. Okay, so there's no need to fear anything. In today's video, I'm just going to educate you on your rights as a patient. Okay, whenever you visit the hospital, there are certain rights you should know. Okay, and there are people that others know their rights, but if you don't use the proper channel to address or seek for the right thing to be done for you, and you go with violence, you might end up finding yourself in trouble. But then how you use it is also another important thing. You don't say because you know your right, you just go to the facility and then you overuse it, and then you end up finding yourself in a hot soup, or you end up causing chaos. Some will come to the facility and they are so difficult. I know my rights, I know my this. Okay, there have been instances where someone will come to the facility and then wants to enter theater, and they will ask you to change into your scrub. You'll be like, no, you don't want to adhere to the protocols of the hospital, the protocols of the procedure they are going to perform, knowing very well that when a surgeon is performing surgery, we don't just enter the theater with any outfit. You have to actually do a surgical hand scrub and gown, or don the proper PPEs or personal protective equipment. You have to change yourself into certain wear before you can enter theater. But you come and you don't want to obey or adhere to these protocols, and you want to enter the theater because you think you have your right, or you know your right. So it's one thing to know your right, and it's another thing to use it appropriately to avoid issues with health workers and things like that. So today I'm just going to let you know some of the rights you have to know as your rights anytime you visit the facility. So the first right I want to talk about is a patient has the right, or you have the right, to know your caregivers. Okay, for instance, you are on an admission and then you are seeing different faces all the time. 30 minutes ago there was one dark short nurse. 2 hours ago there was another slim tall nurse who came to your room. You don't even know who they are. You don't even know whether they are all health workers or they just enter your room or come to your bedside to administer medication. Okay, so if anybody comes, you are on admission, or you go to the facility to seek for care or help, or seek for treatment, and anyone comes around to give you a medication, you have the right to know the person by name, who you are. Are you a student? Are you doing your national service, or you are a permanent staff? Are you a doctor? Are you a nurse? Are you whoever you are? So are you an orderly, or whoever the person is? You are supposed to know. Okay, so you can't afford to just be lying in the facility. Someone will just come holding the medication in their hands and then injecting you, and you don't know whether the person is actually a nurse or not. So you're supposed to know your right. Know that this is a nurse, this is not a nurse, this is a student, this is an orderly. Orderlies are just the cleaners in the hospital. This is an orderly, this is a student nurse, this is a rotation, this is a permanent staff, and you have to know that. So don't just be lying on a bed and anybody comes at all and giving you injection and you are taking. So that's the first right you're supposed to know. The next right is that you have the right to treatment no matter where your location is, whether you are in a remote area, you are in a village, whatsoever. You have the right to quality health care. Health workers are supposed to be going, and which they are doing. They go to these places to give health education, infection prevention and techniques and control, and a whole lot of things. Some of them family planning and immunization and vaccination in those areas. So you have the right to quality education or quality healthcare. So if you are in a place where no government official comes there or no health official comes there, you have been crying, you want healthcare, you are not having any chief's compound there, you have to travel long distance, you have the right to agitate for quality healthcare no matter where you find yourself. You have the right to quality healthcare no matter where you are located. It is your right as a citizen of Ghana. The third right, which people, I don't know why many people, I think it's only, excuse to say, the psychiatry patients, like, they know their rights like anything. In fact, we are giving a medication. I said I will not take it. You can't force me. Okay? But then, how you use it, as I earlier on said, is the most important thing. So imagine you are sick and you are on a routine medication, and then I come to save you and you say you will not take. For whatsoever reason, you cannot swallow the medication. Maybe you can opt for another route if it's oral and you think the oral is so difficult for you, and maybe you want an IV. If that medication has an IV, maybe you can solicit, or they can switch the route of administration to you. Or maybe you are giving you through IV and you are not comfortable with the IV. You can opt for the oral than to say you won't accept it at all. But it is your right to refuse treatment or medication. I'm sick. You have to dress my wound. Maybe this wound dressing, I have to do it every 2 days. I said I won't dress my wound every 2 days. Is it your leg or your hands? So you have the right to refuse treatment or any medication that the health facility or hospital is giving you. It's not by force to swallow anything you are not comfortable with. So you have the right to refuse treatment or refuse medication. You are sick. They say that you have come to the facility and they tell you the only thing that can be done or the only solution is to go for a surgery. And you say you don't want a surgery. No one should impose that on you. So you have the right to refuse treatment, mode of treatment, and whatsoever. Okay? So that is your right. You must know. It's not by force to say that no, because doctor says surgery, I must go for surgery, and you are not convinced or you are not comfortable with it. You have the right to refuse. It's not imposed on anybody. Alright? Another right is right to privacy. So you go to the facility, the nurse cannot just ask you to remove your shirt. I want to check your temperature. Then maybe what you are wearing are supposed to. No, you have the right to privacy. It is your right to tell the nurse that I cannot remove my dress here. At least let's go to a private area, somewhere where it's obscure from the sight of other people. Okay, so you have the right to privacy. So when during consultation, you have to have your privacy. All right, there's a place that at least I want to take an injection on you are going to take an injection on your butt. You can't just expose you where everyone is seated at the OPD or whatsoever and be giving you that particular injection. So you have the right to privacy, and that's one thing you should know. And the next right is right to confidentiality. I'm having this condition, and you shouldn't be telling everybody, identifying me by my condition. Maybe the hypertensive patients, the patient with the wound on the leg, the patient with the ulcer or diabetic foot. No, it's not allowed. So you have the right to confidentiality. All your health records and everything should be kept confidential. All right. If they even want to work on use your condition or whatsoever documents of yours to teach students or whatsoever, you should give a consent before they can use your folder or use your anything to teach student nurses. That's something you should also know. And another right is right to information concerning your condition. Okay, I'm sick. You said I have diabetes. Maybe that's the first time I'm hearing diabetes. I don't know what diabetes is all about. So it is your right to ask the health worker, what is diabetes? Okay, what condition is that? I've never heard it in my life, or I've heard about it, but I don't really have much information about this particular condition. So it is your right to know to have every information about the diabetes. Oh, the health worker should be able to tell you, this is diabetes, this is how it comes about, this is the mode of treatment, okay, this is alternative treatment, this and this and this is what you'll be doing, this is what it entails. If you don't treat it, this is what it might result in. So it is your right for the health worker to tell you or give you information about your condition if you don't have an idea. And there are some patients that are very they know very much about their condition, but they will still ask you, the nurse, to test your knowledge. So that's why I said that knowledge is so broad. You have to learn every time, because you can't afford to be asked a question, somebody's condition, and then you are a health worker, you can't even tell the person, this is this condition, this is how it comes about, this is how we manage it. So as a patient, you go to the hospital and they tell you this is the condition, you have to, if you don't have an idea, you have to know. The nurse or the doctor, whoever is attending to you, the health worker, you have the right to have the right information concerning the treatment, management, and every information about that particular condition of yours. Another basic right you have to know is right to personal safety. Okay, so when you are in the facility, it is the responsibility of the hospital workers to ensure that you are safe at wherever you find yourself. Okay, your right to safety, the bed you are lying on should be clean, dusted, shouldn't expose you to infection. So if you go and they put you on a bed that you know this bed has rusted and is having cracks around a place you can fall, and you have the right to opt for a change, okay, before you fall there or something cuts you and you end up getting another infection. So you have a right to personal safety. You are at a place where louver blades are all broken everywhere, is not looking clean. No, you have the right to personal safety. Whatsoever thing they are using on you should ensure that it doesn't predispose you to any danger. So you have the right. The bed I'm lying on is too high, I'm not comfortable, they have to change it or adjust the bed for you. It's for your own safety. Okay, so you have the right to personal safety in the hospital, and don't be afraid to speak for your rights, but use the right approach to avoid issues. And the last right I want to talk, there are so many of them. You have the right to know the mode of payment of the hospital, the bills, the hospital policies and all that. Maybe you are on an admission and you have come, or you've just visited this hospital for the first time. You don't know how they run their things. Is it does insurance cover everything here? What does insurance cover? You're supposed to know, and it's supposed to be explained to you. This is the mode of payment. When we do this on you, you pay this amount of money. When we do this on you, you pay this amount of money. And if you realize that, or you get to find out that you can't afford this place, you opt for another facility. So if you go to a hospital, you have to know mode of payment and everything, treatment and all that whatever will be entailed in taking care of you. So don't go and lie in the hospital, and at the end of the day, they accumulate a very huge amount of money for you to pay, and you can't pay. So it is your right to know the hospital policy, mode of payment, and whatever is entailed, as much as money is concerned. So these are some of the few rights I've taken you through. I hope the next time you visit the hospital, you know your rights. There are many of them, but I cannot speak or talk about everything in this particular video. It's going to be very, very super long. Okay, so these are some of the rights you're supposed to know as a patient the next time you visit the hospital. So you use it rightfully, so you don't have issues. You don't go and you're fighting with every nurse now. You know, they are same people taking care of you. Okay, and nurses are not God, they don't give life. So when you go, you also have to be patient. Okay, and I always say that you might not meet everybody who will be good to you or nice to you every time you go to the hospital. And then you also have to exercise patience, use your rights, advocate or agitate for your rights where you think you are supposed to. All right, and then use the right approach in requesting for the right things to be done to you. So stay blessed, and then see you some other time. Bye for now.